Fahira Sahir from Senator Tim Kaine's office. I'll give you a brief rundown of the events for today. We'll begin with the Pledge of Allegiance. Following that, then we'll have remarks from our local VA leadership, including Mr. William Barksdale. He is the Assistant Director of the Roanoke Regional Veteran Benefits Administration Office, and then Ms. Rebecca Stackhouse, who is the Executive Director of the Salem VA Healthcare System. After that, we're going to take some time to give special recognition to Vietnam-era veterans who are joining us today. This is part of an ongoing commitment to honor the 50th anniversary of the end of the Vietnam War. So any Vietnam-era veteran who has not yet received a 50th anniversary commemorative pin and presidential certificate should see first Ashley Bradley and Crystal Connor. Wave your hands, please, ladies, on either side of the auditorium. See them at some point during this town hall before we present those pins. And so
thanks for you all being here, and thank you for your service. Just want to give you some remarks about the Roanoke Regional Office and the great work we're doing there on the benefits side of the public. So in July, actually in April of 2024, our office was asked to join our San Juan processing office to help with the processing of military sexual trauma claims. These are very specific and very difficult claims to process. It's a lot of research, but they asked us, and so we were honored to do so, to be able to process those claims to get those benefits out faster and with accuracy to those long-waiting veterans. So through our work, I'll let you know that since joining, we became fully operational in July of 2024. Our work has led to the reduction in what we call average days pending, meaning the length of time the claim is pending with us. And that has gone down from 219 days to now 176 days. And the average days to complete those claims went down from 329 days to now 221 days. So we're 100 days faster since we've joined that operation, and we're really proud of that. And we're doing so with 94% quality as well. So we'll continue working with the San Juan Regional Office. We have about 225 or so employees that are dedicated to those claims. We also work regular claims for veterans across Virginia and the country as well. We'll continue doing that along the same way and providing that excellent service. Just some information for you. We are in a hiring freeze, and we hope to resume hiring later on. We have some main positions that were exempted. If you see in the TV that these positions were exempted for furloughs or terminations. We have what we call a Veterans Claims Examiner position or Veteran Service Representative position, a rating Veteran Service position. And then also we have positions, what we call counseling positions, rehabilitation counseling, and vocational rehabilitation specialists. Those are unique positions to the Veterans Benefits Administration, and they're critical to our success. So luckily those were exempted from any type of loss, because especially in our counseling position, we help veterans in our vocational or veteran readiness and employment division. We help veterans go back to school or do vocational school, and we help them find jobs. So it's very important for us to have a case manager, a counselor that will help them do that. And with those losses, that would be detrimental to the services we would provide. And the other claims, the claims processing would be the same. For our disability claims process, we also process pension claims in some of our offices as well. We need to maintain those particular positions. And then lastly, one of the other positions that you might interact with is our national contact centers, or national call centers. We have about 7 call centers across the country to take calls from veterans from about 7 to 7 each day, Monday through Friday. And those representatives are not subject to reduction at this time, nor are folks that work in our regional offices and see veterans face-to-face. So any type of public connection to the veteran are not subject to the reduction at this time. But we're pleased to continue the great work we're doing. I look forward, if you have any questions, I'll be glad to talk with you back at the back table back there if you have any specific questions to your claims. But again, thank you for being here, and thank you for your service, and we look forward to continue serving you throughout the year. Thank you.
Thank you, Mr. Barksdale. Good afternoon, everyone. Again, I'm Becky Stackhouse. I'm the Executive Director here. A few updates for you. I always like to start with kind of proudly announcing that for the second year in a row, as rated by the Centers for Medicare and Medicaid Services, Salem VA healthcare system has been rated a 5-star quality facility, so providing the very top-notch healthcare to our veterans. We continue to work very aggressively to make sure that veterans can easily access that high-quality healthcare. So working on making sure, especially for new appointments, new veterans, that we can get you seen timely. For both our primary care and our mental health areas, we have gotten to the point where we are able to see those new veterans below the 20-day and a threshold benchmark that VA has set for us. We're seeing new patients within primary care in approximately 16 days, and for mental health, approximately 19 days. We have a wide range of specialty services that we provide. So of course, it's gonna vary a little bit depending on what the specialty is, but overall, we're able to see new veterans in our specialty care areas in approximately 42 days. We're still not meeting the 28-day goal that we've set, but a year ago, we were in the 70s for wait times for our specialty clinics. So again, the staff continue to make great strides in making sure that veterans can access that care. We do have some exciting new things, new developments that are happening here, to include Salem has entered into the robotic surgery area. We have not only a Da Vinci, or what your more traditional robotic surgery program. We've completed several surgeries with that system, but we also have a platform that takes a look at robotic, it's ion bronchoscopy robotic program, which is a new technology that you're not going to find in a lot of areas throughout the country. And we have a interventional pulmonologist who's really spearheaded that, completed some initial cases. And so we're just so excited about being able to bring those platforms here and provide those robotic surgery services for our veterans. Additionally, we were successful in recruiting and bringing on board a periodontist. So Dr. Tanisha Notice is our new periodontist, and what she's going to bring is some more advanced dental reconstruction potential here in our dental clinics. And instead of our veterans needing to receive those services elsewhere, she's going to be able to provide those services, to include some implants that we have. So very excited about that. Also want to make sure that all veterans and caregivers are aware, there's the Patronage Expansion Act, which was passed into law a couple of years ago, not really well known. But what this is it allows certain eligible veterans and their caregivers to access different Department of Defense installations for shopping at the commissary or the exchanges, some of the recreational facilities. So I do have a flyer that is on that back table if you're interested in learning more about that. I know we don't have any DOD installations readily near us, but if you're out and about traveling, this may be a great benefit that you want to take advantage of. Also, advancements. I'm sure if you come to the medical center on a frequent basis, you know that we are perpetually under a state of construction, a state of improvement, and we have over $70 million worth of active construction happening across our campus right now. That includes finishing up the work so that we have our second inpatient medical surgical unit on the 4th floor of building 143. And again, the project for that is it converts our former 2, 3, 4 patient bedrooms into all private rooms with private bathrooms. So we're finishing up some interior work on the H wing for that, some lobby renovation up there with the elevators, and we hope that we'll be able to have that unit online and activated by certainly midsummer to late summer. Also, our emergency department is getting a greater than 6,000 foot expansion and renovation, which will also eliminate those multiple patient bays with just the thin curtain in between to all private treatment rooms within our emergency department. And our goal is to have that project completely finished, totally online, and activated by the end of the calendar year. We're also continuing design efforts to do further renovations and upgrades in our operating rooms. Also renovation to our Building 143 lobby. We are in the middle of a pretty significant upgrade to our signage and wayfinding. We have a big campus. Right? We have 220 acres, we have over 1 million square feet of space here. It can be challenging sometimes if you don't know your way around. So our new wayfinding and signage project will make that much easier, and that should be hopefully wrapped up within the next 6 months. Also, a couple of events that I just want to bring to your attention. On March 29th, we will be holding a Vietnam Veterans Day celebration here in this very spot in our Building 5 auditorium. That will be at 3 p.m. Also, we are in the works to plan a special Memorial Day celebration here that will happen both here within the auditorium and then, weather permitting, in our memorial garden out there. And then our next Veteran Town Hall will be held on May 7th. So a lot of different things coming up. But more importantly, before I turn this over and introduce a very special guest who's going to come up and help me with a very special presentation, I just want to sincerely thank you. Thank you to veterans, thank you to the caregivers of veterans for trusting us and for choosing the Salem VA healthcare system to be your healthcare provider. We've been providing healthcare to veterans for 90 years, over 90 years, and we take great pride in that. This is your facility, and we're very fortunate to be able to provide services to you. At this time, I want to invite up Colonel John Miller, who is going to help with a special Vietnam veteran pin presentation. And Colonel Miller and I have been doing these presentations for quite a while, and I've lost count of the number that we've done, but he has been such a huge partner with us in making sure that we can appropriately recognize and welcome home our Vietnam veterans. So Colonel Miller?
Thanks very much. If you bear with me, I appreciate your listening to me for a couple of minutes. I think most of you are aware that the Vietnam era veteran wasn't treated as well as he or she should have been when we came back from the country, or when we were just serving on active duty. Authorized by Congress and proclamations issued by 3 presidents, Obama, Trump, and Biden, created a commission for the recognition of Vietnam era veterans. The veteran was identified as anyone who served on active duty in any of the armed services between 1 November 1955 and 15 May 1975. All of those who served during that period are entitled to wear a special lapel pin, minted solely for this purpose, and has a bunch of symbology associated with it, to include an eagle on the front, stars representing the allies that served and sacrificed with us in Vietnam, and the wave signifying Old Glory. But on the back of this pin is engraved, "A grateful nation thanks and honors you," to the Vietnam era veteran. And it's my honor, I understand we have at least one to receive the pin this morning. And may I invite Bill and Ms. Stackhouse to take their positions. And I would invite Cecil Orlando Jameson II, U.S. Army. that deserve to receive this pin, Ms. Stackhouse and I want to make sure that we've made every effort to present this pin to those who earned it. Is there anyone here that has not received this pin? Would you come forward, please? Please take a seat. We want to make sure everyone is covered. It'll take a few minutes, so you've been waiting 50 years for this. So wait for a second. We'll make sure you're on. Mr. Wayne Chapman, United States Army. Mr. Dave Palmer, U.S. Marine Corps. Mr. Arthur Kenneth, U.S. Army. Betty Pearson, U.S. Navy. U.S. Army. Dennis Pinkley, U.S. Army.
William White, U.S. Army.
Policy. It's
So
just
I'm not gonna comment though on a medical, because I'm not a physician, but I have two outstanding physicians up here who I'm gonna have connect with you to discuss that. And
You
go
made
through
that decision though,
So, at the recommendation
not my doctor.
of physicians. But we'll talk with you about it, absolutely, because I can understand and appreciate your concern. Thank you for that.
Mhm.
All right, I said, yes, sir.
Yes, you've had 20-plus positions terminated because of freezes and stuff like that. Are those 20-plus still terminated, or any have seen that didn't destroy?
So two separate actions. The federal government, all federal agencies were placed on a hiring freeze upon the entry of the new administration. So that is separate from the terminations of probationary employees. So we had 118 occupations that were exempt from the hiring freeze, that we're still able to hire and bring on those staff. Physicians, nurses, therapists, psychologists, we're still able to bring those folks on. The probationary terminations, those individuals typically serve less than a year within the federal government, or 2 years if they were a different occupation. Those positions are still no longer employees with us. However, we have submitted for exceptions or a request to bring those folks back. We've not received the determination of our request at this time.
So they're still terminated.
At this point.
Are you able to hire right now?
Yeah, most occupations that we have, not all, but most occupations that we have. So we're, excuse me, we're still bringing on certain employees. So again, those that do direct patient care for the most part are not subject to that hiring freeze.
So I think I get excellent care from the VA here, and I
Thank
appreciate
you.
that. But I'm concerned about we having the adequate resources, not just physicians, but other people that are valuable, that you get those positions restored. I think it's been quite detrimental to the system for you to have lost positions.
True,
You should be gaining positions, not losing positions.
And we have a group of new employees who are actually starting Monday. We're still bringing staff on. We're still bringing staff on that are going to be able to provide service to our veterans. And we will do what we need to do to make sure that veterans' health care and services are not interrupted and not impacted.
I want to ask Ken.
Yes, sir.
I want to make sure I understood you correctly.
Yes, sir.
I go to the vet center on Friday night.
Okay.
I have a therapist there, I have a group session, I'm there twice a week. Is it any cause at all for them to worry about their positions being shut down or canceled or terminated or anything like that, or do you even have?
That's a great question. I'm with the Veterans Benefits Administration. The vet center is a separate piece. I have not seen their job, whether they're exempt or not exempted, but I would just say, since they're direct counselors, I would say that would be limited if they do. But I don't have that information directly to say that. The counseling I'm talking about is people in what we call our Veteran Readiness and Employment section, or vocational rehabilitation is the old name for it, where we provide direct case management counseling, get veterans in school, follow them through the school process, help pay assistance allowance, help pay for their school. Those are the counselors I'm talking
Years ago,
about.
I was there.
Great, that's great. Yeah, and we find them jobs too.
Yeah.
So it's a great program. Yes, sir. Thank you for your question.
I just was asked to ask this question.
Yes, sir.
Because
I know them in the vet
I
center.
know a vet that go there.
Yes, sir. Yeah, I'm familiar with them. I have lunch all the time with John, who used to be at the vet center, John Whitlock. But I have have not heard officially anything about that. Yes, sir.
Thank you.
Mhm.
Yes, ma'am. I have a question. This current administration, they're cutting and cutting and cutting. How are they expecting you to meet your benchmarks on patient care, on all the care, when they're losing to everyone for you?
So just to make sure folks understand the perspective, we are still able to hire staff. We're still going to have staff that we need to provide essential services to our veterans. So we're not talking situations where we have mass numbers of staff that have been cut, or that I project probably will be cut. We're here to fulfill our mission. We're here to make sure that we provide healthcare treatment and services to you all. This is your facility. Now, may we possibly need to do things a little bit differently? Maybe. It's too early in the process to really tell if we need to do that, but we will absolutely be here. And we will absolutely make sure that we're providing you the healthcare that you've earned and the healthcare that you deserve.
Thank you.
Absolutely.
And are you speaking for all VA hospitals?
I'm just speaking for Salem. Absolutely.
I want to thank y'all first of all for this healthcare getting here. I'm super impressed and pleased with the quality of past healthcare getting here. But only one full question for getting, and I look back and the legislators that came in, they're gone. And I don't see them.
As expected.
Yeah, I don't see them. It's a shame because all these questions they should hopefully notes down on them. Always priority, concern, and compassion you have to ask those questions. They should be here.
So we did meet with the congressional staff folks right before this meeting, and so we had that opportunity to dialogue with them.
Not us.
But we didn't.
Yeah.
But they came and before they could say anything, question number one, they were gone.
Yeah.
Amen.
Especially since a lot of them are not taking emails, phone calls, town halls, they're not.
And we'll be happy if you have specific things that you would like us to pass on.
We
to
would
them.
like to do it.
Well, absolutely, we can write that down, and we have contact information.
I know about that. You've done great healthcare here, and I appreciate you and your staff. Thank you again.
Appreciate
But
it.
what a missed opportunity.
And I just wanted to add too, as a patient parent, I had nothing but great experiences with all of the staff and providers, and access for the things I needed have been outstanding. And so I just wanted to pass on or say for the record, like I was heartbroken this morning. Sorry, when I read that the VA is planning on cutting 83,000 more positions.
That's all I question.
Sorry. But
That's what I want to
don't
ask.
believe or understand how they cannot negatively impact healthcare or benefits by firing 83,000 more people on top of the 2,500 they've already cut. And also would like to pass on my concern about the PACT Act protections, because I've also read some things. Project 2025 says in regards to benefits that we should no longer provide disability benefits related to presumptive conditions from Agent Orange and burn pit exposures that are currently protected under the PACT Act. So I just want to say that I hope that all of our representatives will continue to advocate for the VA and for us, and I know the Vietnam veterans fought for decades to get those Agent Orange protections. And so I really, really hope that our representatives will continue to speak up for us and advocate for us, and for the PACT Act in particular.
The ones that aren't here.
Thank you for the feedback.
Woo! Woo! The accent one.
You have my commitment that we will do whatever we need to do to make sure that we can provide you that great care. And I sometimes joke that I wish I had a crystal ball to see what was coming. We don't have that, but the commitment is not going to change from our staff, from our facility, from our community-based outpatient clinics, to make sure that we continue to provide you the very best that we can. And to speculate what may happen in the future, I want to focus on what we're doing here today, but I appreciate it.
Since you volunteered to speak to the congressman and
Yes.
representatives, I would ask that you would share with him what it would do to you to lose positions. This 83,000 or 85,000, whatever that number is, but the VA cannot afford to lose positions. And all the congressmen need to hear that, from the people who are affected, not only the citizens, the veterans, but for the people who have to administer the health care.
And who makes the decisions on who's gonna be cut? I mean,
Elon
anyone
Musk.
doing
Yeah.
due diligence, or are they just taking a hatchet and chopping things, you know?
Right now, the VA is in the first phase, which is determining the plans. So they're outlining the plans and talking about what the plans may be. And again, we're talking what I call big VA. So not just the medical centers, not just the regional offices, but the cabinet level department. Right? When you see some of those figures, that's for all big VA, not just, impacts at the local level. But the agency head, which is the Secretary of VA, if you read the actual process for reductions in force, is the one who determines the plans. Those discussions have just started, and so there will be opportunity for us in the field, to engage and take a look at what those plans are. To reassure you, I'm fairly confident that feedback has gotten.
I was at the client's office yesterday, and the staff wouldn't even talk to us. So, there you're in a conundrum, But is that gonna be transparent, and we know ahead of time?
I'm not sure. I would be guessing, so I don't wanna speculate
It's not good that
on
people have to
that.
guess when it comes to their health care. My husband's been going to VA for years, and to think that that's gonna be cut down in some sense. Even when people do the ordering and different things like that, you may not consider it health care, but it will impact the patients.
And again, I think that, we may need to do things a little differently in how we do things, but you have my commitment that we're gonna continue to be here. Okay, we're gonna continue to provide you the highest quality care that we can, absolutely.
And one thing I'll add to that, on the benefits side, I have not seen anything regarding back there, any rollback of that whatsoever. We're actually trying to expand it, just expanded in August of last year again, and it will continue to as far as we see. And as far as from staffing thing, we think all of our staff are critical, just as Ms. Stackhouse has said. So regardless, I know we talked about a couple of key positions we have in the Veterans Benefits Administration, but all of our positions are critical. So we're doing what we can to voice our concern about that and fight for reconsiderations.
Hi, my name's Bridget Kelly. I bring a 83-year-old vet from Rockbridge County here to this hospital for his services. And I talked to him about the cuts and what work is like here now. And he said, it used to be really bad. It was hard to get an appointment. It took a long, long time. And this was prior to the PACT Act. He said, it's good now. I can get in. It's, I don't see anybody not working. And you yourself said that it used to be 70 some days for the special doctors, and you're trying to get that down. And how can you do that when staff's being cut? I heard on the news coming in that the Veterans Administration has pledged to take the staffing levels prior to the PACT Act.
So thank you for the question, thank you for the feedback, that we've gotten better, that makes me feel good.
But are we gonna go back?
Yeah, the staff that we've seen impacted thus far are not direct patient care staff. And the ones that are seeing our veterans, providing the active treatment.
But 2,400 versus, 85,000.
Right, across the entire United States, U.S. territory, so big VA, you're talking an organization that has, 470-some thousand employees. Right, so not just Salem VA, so when you hear those numbers, again, putting it in that perspective, that when the secretary says, we're gonna take a look at, he's talking the entire department, the entire cabinet level department. So again,
But that's like 18% of the staff you said you currently had. 85,000 is 18% of what you just said you currently have.
right, around
So like 20%
470
of the staff you're gonna cut, and you're gonna believe that you're gonna keep the care up?
we are gonna do everything possible to
Good luck.
make sure that that happens.
All right.
Absolutely. Again, I don't wanna speculate, I don't want to predict, what the future is going to be. Maybe we have to make some changes to some things and how we do some things, perhaps. But I don't know what the impact is going to be with us, but I do know that my commitment, my resolve remains very, very strong. And we have great staff here. We have extremely dedicated, committed staff.
Yes, you do. Keep them.
Already saying that they're already short-staffed. Every nurse that I talk to says, man, we're running around like crazy because we're short-staffed already. Like, this is last year, you were short-staffed.
Yeah.
According to nurses and doctors.
There are some challenges with some occupations. You know, nursing is one. We've made great strides. Bringing nurses on, and bringing primary care physicians and primary care providers on. A year ago, we had several vacancies. We're almost, I think, fully staffed at this point in primary care. You're always going to have those periods where you have pockets of vacancies. People retire, people move to Idaho for personal reasons, different things that happen. So you're constantly going to be in that state of recruitment. And again, with some exceptions, more administrative type positions, we are able to continue to hire. We're able to continue to bring on those staff that are responsible for providing that direct patient care.
You said you had some positions that were removed because of a directive. Given, if you had authority to choose, would you have removed those positions by your own decision, or would you have added positions to meet the goals that you're talking about?
Yeah, thank you for putting me on the spot. Given my choice, right?
Your choice.
Our staffing would not change. Our staffing would not change. Because we have brought on staff who we feel we need to effectively run the facility. Doesn't mean we can't run the facility effectively without those staff. We just have to change a few things, but again, hopefully that the veteran does not experience. They happen behind the scenes. Yes, ma'am.
Hi, so I actually have this, I know that you had mentioned, that the people who were let go were not in direct, contact with patients. However, I spoke with 2 recreational therapists who were fired, who do work hands-on with, patients. So I was wondering if I'm incorrect about that, and
The majority of the probationary employees who were terminated were not in direct patient care.
Right.
Not all. There were a couple that were not on the exemption list.
okay, and so, I mean, now that they're gone, is it, because they had told me there's only like 1 person for this one entire floor, is it just going to be a lot more hectic there, or people not gonna get as much care?
So we have some resources within recreation therapy that we're able to provide the essential services. But are things going to be a little bit different? Sure.
I would just share the feedback that I think you need to share as a governor. Is that when government employees are being termed as not nice names, that makes it hard for you to recruit people when federal employees are bad-mouthed by the President, Congress, and President administration. So I think it would be helpful for you to feed back to those above you that makes your life harder to recruit people, harder to keep people. And I think that feedback needs to occur from the public, but also from those who have to hire people who hear things like that.
Thank you for feedback. Appreciate that.
I
just want to say, I get real good care here.
Thank you.
And I appreciate that. And we just have to wait and see how stuff shifts out. And Congressman Griggle, we met with about, well, he came down quite Bedford in Franklin County and said, veterans, what do you all need? Not that many people showed up, but he does want to help the veterans, and he has empathy for our situation, and I'm glad for that.
Thoughts and
And I
prayers.
volunteered up there for 3.5 years as a serving coffee and tea and cookies to the veterans and civilians. And if you want to see what goes on up here and see how good it is, just volunteer up here. Whether it's the Red Cross or whoever that's doing, you can find out. Check with my staff house and find out. And you can come up here and volunteer, and you'll find out what goes on. And I did not even know what palliative was until I volunteered up here. I found out how to spell it and what it was, and they get very good treatment. So I just will say that I appreciate the treatment I get here, and I think you all do a good job, and I thank you.
Appreciate that.
And I'm just curious, could you cover a little bit about what the probationary jobs were, what some of the titles were? What is probationary?
So probationary typically means that the employee was in the position or a federal employee for less than 1 year. There are some positions, mainly clinical positions, physician nurses, that the probationary period is 2 years. So the folks that were in that round of probationary terminations were employees, again, that either were in the job less than 1 year, federal employees for less than 1 year, or that 2-year time frame.
But isn't it true that sometimes when you're switching between different divisions of the government, that even though you've served a long time, that you become probationary? So like,
There are limited circumstances where that could be the case. If I'm a non-supervisory employee and I move into a supervisory position, there is a new supervisory probationary period. There were errors throughout the country that happened on the lists of those probationary employees, and that's where agencies had the opportunity to go in and say, that's not correct, this is not a probationary employee.
and what kind of jobs here in Salem were probationary that got fired?
With the exception of the two recreation therapists, they were administrative positions.
Okay. Thank you.
Being very patient.
Everybody, retired first sergeant, 2.5 years, also retired from the Army, I got civilian experience. And the new administration wants to run the country as a business. I've been involved in a lot of layoffs. And a lot of layoffs look good on paper, but they wind up saying, oh, this manpower is wrong. So they add back manpower here and there. One question is, do you foresee that happening? And another question, and another change that needs to be made is rec therapy, music therapy. It needs to fall under the psychiatry umbrella for future, because us with PTSD and mental illnesses use that a lot, and we learn that a lot for care. It ain't just going out fishing, it's learning hobbies and stuff to cope with outside and like if you're by yourself and stuff like that.
Absolutely. In my background, where I started in the VA, I'm a recreation therapist. That's my background. I wouldn't begin to speculate on layoffs or rifts, again, not knowing what may happen in the future. And our recreation therapists, our music therapists right now are organizationally aligned under our physical medicine and rehabilitation service. So along with our physical therapists, occupational therapists, and then to create some of that professional cohesion. I appreciate that feedback.
My follow-up question is, I know the rec therapy, music therapy is mandated up here. As far as what umbrella it falls under, is that mandated higher or is that local?
No, that's a local
So
determination.
you could feasibly put your committee together and put it under.
Yeah.
That's
We can take
what-
a look at that, absolutely.
This is a suggestion. Now, up here, they're not doing committees and looking at stuff, they're just cut just like a business. If you could, in your committee, could you look at it, please?
Yes, absolutely.
I have two questions, if I may. First question is, I know the staff and all you said you have today. That may not be tomorrow and the next day, especially once you mentioned the 83,000 throughout the VA that we taken away. My question is, if that occurs and your staff gets low, are these veterans going to know, and I'll be aware that they can go to outside providers and that it will be covered
Yes.
through the VA reimbursing for the outside hospital?
Right, so our community care program will continue to remain. And actually, VA has partnered with the community to provide care since its inception. Because the VA can't provide everything that's necessary, but yes, we will communicate well in advance if there are going to be significant changes to the healthcare provision. Absolutely, we're going to do that.
With my husband, you had to go through a process to get approved and have to wait.
Correct.
And if the staff is cut and they're backed up, they can go on to these doctors and not wait a month to find out if you're going to approve them to see another doctor.
So they still need to meet the eligibility requirements for community care. I've not gotten any indication that those are going to change. But if there's going to be, again, a significant shift,
Yes.
we absolutely are going to communicate that ahead of time.
Because I would anticipate a high volume wanting to go to outside facilities if you're cut short. So that was my concern for them. And then my other question is, since the representatives and congressmen kind of just, their heads ran out of here, can the veterans ask the VA on their behalf to set up a meeting in this place and that they attend to answer questions for these veterans? Or would we need to get a petition for you to get that to happen? Because we run around everywhere and they're hiding, no one comes out. And these veterans want to have them there instead of them having to run everywhere to find them.
So if veterans are interested in holding a meeting or having an event here, absolutely, we can work with them to make sure that the space is available, and we have the setup for that, like we're doing for the Vietnam veteran event.
So can you request them to come?
I can pass the communication on that there is significant interest, and that we can make our space available.
Will we contact you for that? Will we contact you for
Yeah,
that?
we can give you contact information after, sure. That microphone.
You talking about going outside, I'll share this with you, they found that I had AMD up here and also at Vistar at the same time. But they let me go to Vistar because it's 45 minutes closer to me than to be there. But they found it here and at Vistar at the same time, and they let me go out there, so, and I appreciate that.
But the time for approval,
And-
staff start going away, are these patients gonna get to doctors in time? So that's my concern.
And could you just clarify how many people have actually been fired here in Salem?
So I'm not comfortable in talking about that number because it was not a large number, and I want to respect their privacy.
Yes, this is more of like a benefits related question. I've had a lot of veterans talking to me about payments getting late, especially like veterans using GI Bill. Is this kind of a like sign to come, that a lot of payments are going to be late?
Right, I'm not seeing payments being delayed. If there's a specific thing, we need to look into that, but I've not heard of any type of delay in benefits being paid, because on the education side, we have what we call an enrollment certification that goes into the school, and as long as you're enrolled, say from September till May, and the certification is done electronically, it should come, just like clockwork. It should not be an issue.
Well, I know some of this has been raised recently, in the last couple of weeks, whether it's disability payments not getting on time or like housing allowance from education benefits. So it feels like it's a more recent thing. That people who have been getting it steadily with no issue, now there's for some reason an issue.
I'd like to, if they are, they need to contact our 800 number, 1-800-827-1000. That's our main number that I was talking about earlier. And they need to look into that and see if it's a case by case or if there's something going on have seen that by now. We would have gotten mass communication saying there's a delay in the process of payment, and I have not seen that. Thank you.
I know earlier you were talking about, there was a question asked about how a terminated employee was let go during this fire. I know you said it's kind of big VA who has kind of the plan or the strategy that's coming into place. And when I did get a chance to talk to one of those employees that were unfortunately fired, they gave me a document that said the Office of Personnel Management was the one that kind of led to that decision. Can you kind of just give a little bit of clarification as to either is that them making a decision or are they telling you, hey, we got to let some people go? Because I just got it.
Thank you for the question. Office of Personnel Management is the federal government's big HR arm. They're communicating down from that big HR arm to VA. And say, here are the staff that have been identified on the probationary list to be terminated.
Gotcha. And then kind of an extension that you talked about the strategies, like, big VA. Can you kind of, is there a way that you guys know about how they're determining that, what the plan is, or the strategy that they're talking about?
So we've not received communication yet in terms of the plan. Again, I think it's in the very initial conversation discussion period of that. Typically what happens is once plans are identified, then that will be communicated down regionally and then to the local level. But we've not received any of that communication at this time.
Thank you.
I want to piggyback on that, just to make sure I'm aware. So, did they let you guys know who to let go, or is that like an internal decision between the Salem VA Medical Center?
So for the people that were terminated to date,
Yes.
no, that was not a local decision.
Okay. So it's one of those things that they let you know, hey, these people have to go, and then you guys kind of send off that information.
I think communication was directly sent to those individuals.
So you guys had nothing to do with, choosing anything like that?
No. We were not involved in that round of decision making.
I was just wondering, for a while, about, staff, nurses, and, therapists, and people like that, has been like that, and, I was just wondering, will there always be, jobs open for in mental health? Cause I ain't heard nothing about any mental health, positions.
Sure, mental health positions at this time are exempt from like the hiring freeze and that. If I had my crystal ball, I would say yes. We would probably always have positions available in
Does
mental
that
health.
include counselors and, other staff for, mental health?
We're still hiring for all those folks.
I've been coming up here for 30-some years, and, if it wasn't for mental health here, I wouldn't be here. Plus, the medical side too.
We're still hiring for social workers, psychologists, psychiatrists, peer support counselors, all those folks. Yep, we're still actively hiring.
I just want to make sure, we've met the other VAs and staff here, and
From your regular brain cookie.
Yeah.
I'll wait for it. I want to comment on her comment. The reason she's getting the care she's getting is because the people here at the Salem VA really care about that. They're working scared to death because they don't know if they're next, but they're still doing their job, and that's awesome. You've got to be an excellent leader.
Well, thank you. It's the team that makes it easy. It's the team that comes every day, and again,
You know
really
it's
knows
here.
that we're here.
Were these cuts from the DOGE agency or whatever?
I don't have that exact information. Any other questions?
What kind of cookies?
You gotta have a little levity somewhere.
And again, follow up with, but again, if you have individual benefits, case questions, medical questions, we'll be glad to
talk with you, but thank you, everyone, for coming today. Congratulations again to our Vietnam veterans.
Woo! Woo-hoo!
Healthcare, to the feedback, the positive feedback, it was very helpful.
I know you said that due to these environments, you guys are going to do your best to continue the services. How do you, in the immediate impact, how do you guys try to balance that and continue to provide that service that some of these veterans say has been top notch?
Sure. So a few people have picked up some additional duties to help make sure that services are uninterrupted for our veterans. And just making sure that our staff continue to show up and do what we all took an oath to do, to provide the very best care to our veterans.
So in that internal memo released today, it's expected that 80,000 more people from the VA nationwide are going to be losing their jobs. Is there a possibility, is there a chance that some more people are losing their jobs here? And if so, is it going to just be mostly administrative positions, or is it going to also be people who are working one-on-one with the patients?
So I'm unable to comment on that because I've not seen that memo.
Okay.
Any further questions at this time?
Oh no. I mean,
Give you a quick second here. Do you have one you want to ask?
Jason, think about it. And it's kind of related to sort of the feedback. It was striking to one person who said, you know, despite the uncertainty, people are doing the best they can. What do you think that says about the people who work for the VA here in Salem and across the state?
So you can't comment about employees who work across the country in the VA. Here in Salem, we have the best staff. We have the most dedicated, mission-focused staff that I've had the pleasure of being able to work with.
You said a couple of times that you may have to do things differently. Have you begun to formulate those plans? What's your message?
So if veterans hear that, what they need to hear is we are going to continue to make sure that we provide them the absolute best health care, treatment, and services that they trust us to provide to them, that they've earned, and that they deserve.
Anything else? All right, thank you, everyone.